shine on the light. Welcome to chat night, we bring you good vibe, we shine on the light. We all over the world, chat night Africa. We all over the world, chat night Africa. Welcome to chat night, we bring you good vibe, we shine on the light. Welcome to chat night, we bring you good vibe, we shine on the light. We all over the world, chat night Africa. We all over the world, chat night Africa. Welcome to chat night, the only place that we give you good vibes. Chat night Africa. Welcome to chat night, all over the world we are shining the light. Chat night Africa. Welcome to chat night.
Many people now dead would be alive had they just done core routine medical checkups. Unfortunately, people don't act until there is a perceived threat. You've heard of blood pressure as a silent killer. It's for a reason that it is. We don't want you to be another statistic. And that is why on Healthline this week is a leading cardiothoracic surgeon, Professor Nche Abegli Zama. One of two things will happen when you watch this broadcast. You can ignore it or do something about it. Here is the thing. With choices come consequences. This gentle reminder: knowledge is power only when you act on what you know. My friend, if your health is your greatest asset, time is of the essence. Note this: action delayed is action regrettable. This is the kind of content you watch when you make Chat Night Africa your companion. Ladies and gentlemen, join me now in welcoming the erudite cardiothoracic surgeon, Professor Nche Abegli Zama, on the platform.
Good evening.
Thank you, Dr. Zama, for coming again on the Hot Seat Chat Night Africa's Healthline.
Well, it's my pleasure to join you today, and thank you for all the great work that you do spreading the gospel about wellness. And as you said, there's nothing greater than preventive medicine, and that's what we're going to talk about today as far as cancer, heart disease, and a bunch of other things.
You must have already realized that Professor Zama's passion about your health can burn down an entire forest. Thank you again for coming to the show. Professor Zama, let's start with this. Are some deaths that you observe, whether here in the United States, in Europe, in Africa, and I name all these places because you travel a lot, you've seen it all, you've cut into thousands of hearts. So are some of these deaths that you see avoidable if people just have their medical checkups?
Certainly. We're all a product of our genes and our environment. And at least in 2025, there's only so much we can do to modify our genes and reduce our risks. But what we do know is that multiple environmental factors can influence the health that we have. And I'm talking in the realm of cancer, heart disease, and certain problems we call metabolic problems. So all kinds of health problems that people grapple with, there's a significant number of those that could have been avoided had individuals chosen a different lifestyle.
That is beautiful. Thank you, sir. Now, the question becomes, how can somebody determine which screenings are most appropriate for them?
So, well, let's start off, and I believe let's talk about cancer, a few select cancers, and then a few general, discussions on other cancers. Now, One of the most common cancers, and let's start with breast cancer. Breast cancer is a serious problem, and every year we get a few 100,000 new diagnoses, at least in the United States. Now, that becomes a challenge in developing countries because, first of all, there's not as the access to healthcare and diagnosis is not the way it is in the West. And we know that tens of thousands of women die, at least in the United States, each year from breast cancer. Now, breast cancer is a cancer that, like many other cancers, if it's diagnosed at an early age, early stage, you stand a better chance of a cure. Now, if it's metastatic, then obviously the survival goes way down. Now, if breast cancer is diagnosed at stage 0, when it's not metastasized, there's about a 95% chance that you will live 10 years. So early diagnosis is important. Now, there are guidelines. Well, first of all, how do you diagnose breast cancer? I have to tell you that the vast majority of breast cancers are diagnosed by the women themselves. So what we generally do is we encourage women to do breast self-exam. And you pick a certain time, maybe after your menstrual period, about a week or so, a couple of weeks after, and you're in the shower or you're sitting on the side of the bed and you examine your breasts, and if you do that often enough and frequently enough, you begin to become really comfortable with the anatomy, with how the breast feels. And so when there's a new lump, you'll be the first one to recognize it. And oftentimes, those are earlier cancers when the further investigation is done. Now, there's certain guidelines also as far as screening for breast cancer. If you have access to mammography, mammogram, and other types of scans, now when can you or when should you have these? Well, the most recent guidelines for breast cancer screening state that starting at age 40 all the way to age 74 and beyond, you should at least get a mammogram, and then you can get it biannually every 2 years. So starting at age 40, that's for the average risk individual. And what do I mean by average risk? I'm talking about somebody without a family history of breast cancer. If you have a first degree relative history of breast cancer, you need to start actually sooner. And instead of going every other year, you need to have these scans, the mammograms performed every year, annually. And that's important. So also, if you have dense breast, and let me repeat that, those that you've been told you have very fibrous breast, those can hide masses, tumors. It may not be as easy to ascertain a mass, an abnormal mass. So you probably need to talk to your doctor and be sure to get a mammogram annually. So that's an exception. So for average risk individuals, age 40 to about 74, a mammogram every other year. And a high risk individual with a family history of breast cancer, somebody who's got really dense, fibrous breast. And also, very importantly, if you have a genetic risk, if you have certain genetic mutations, and I'm talking specifically about the one that they call BRCA, BRCA1. Now, that's a mutation. If you have been diagnosed with that mutation, you're at high risk for breast cancer, and you need to be individualized as far as the cancer screening is concerned, and you need to be followed more frequently. Now, remember, I give you the example of Angelina Jolie, a celebrated movie actress who in 2013 was found to have this genetic mutation that I'm talking about, the BRCA1. And she opted to prophylactically have both her breasts removed, bilateral mastectomy, fancy words for that. So this is because the risk is high. When you have that gene, that mutated gene, you have a greater risk for breast cancer, you have a greater risk for ovarian cancer. And so that would be an indication for either following you more aggressively, or in some individuals, like Angelina Jolie, you may opt to have a bilateral mastectomy, that is, have both your breasts removed. Now, remember, the American Cancer Society says that when you're between 40 and 44, well, you need to talk to your doctor about starting a mammogram if you're average risk. But if you're 45 to 54 or so, you need annual mammograms. And if you're older than 55 and you're an average risk individual, you can have biannual mammograms. So if I look at all that data from the United States guidelines, the US Preventive Services Task Force, and the American Cancer Society, when I distill that for you, I would recommend that if you're 40 years of age, you need to have your first mammogram, even if you don't have a family history of breast cancer. You're better off doing that, being on the side of aggression, because I've seen enough younger people with breast cancer. And by the way, oftentimes people who get breast cancer at a younger age have a lot more aggressive cancers. Now, I'm not sure if somebody's going to be asking any questions until I
Yes.
finish. Yeah.
Yeah, go ahead. Go ahead. Because I was going to ask you,
Mhm.
people might want to do all these screenings, whether they're for breast cancer, they're for colorectal cancer, prostate cancer, all the diseases. You have cut into thousands, literally speaking, thousands of hearts. What medical checkups should people do at what ages related to heart problems?
Okay, so I think let me just go through and run through the cancers, and then we can talk about heart disease, and maybe we'll open it up.
Sure.
How's that? Yeah.
Go ahead.
Okay. So another thing about breast cancer is most breast cancer, where does it happen? Most of it happens in the upper outer part of your breast, right medial to your shoulder, below your collarbone, right up in that area towards your armpit. That's where the majority of the breast cancers happen. So if you're examining yourself, you're performing breast self-exam, be sure and concentrate in those areas, the upper outer quadrant. So if you divide the breast area into four, and you have the part in the center here close to your breastbone, I'm talking about this upper outer part on both the left and the right side. And remember, there's a greater number of breast cancers happening in the left breast than in the right breast. Now, we don't seem to understand why, but it's possible because most people are right-handed. And so when they do breast self-exam, they tend to focus a little bit more on the left side, and subsequently they find more cancers in that part of the body. The next major cancer is lung cancer. And just summarily, one of the biggest risk factors, or the biggest risk factor for lung cancer, is cigarette smoking. If you smoke, stop. Don't slow down, just stop. Because that's the number one cause of cancer death, period. And let me repeat that. The number one cause of cancer death is lung cancer. And now, what are the recommendations for screening? Well, about a decade ago, they came out and they said, if you have a history of cigarette smoking and you're between 50 and 80 years of age, you should get screened. Or if you have 20 pack years of smoking, what is 20 pack years? We take the number of cigarette packs that you smoke a day and we multiply it by the number of years you've been smoking. So if you've smoked only for 10 years, but you smoke 2 packs a day, that's 2 times 10, which is 20. Or if you smoke 1 pack a day for 20 years, that's 20 packs. So, and then if you're a current smoker or you quit within the past 15 years, you should get a lung screen. And what does that constitute? It is a low dose CAT scan. It's a specific type of CAT scan. When this is done, we have a greater chance of catching lung cancer at an early age. And let me tell you, at an early stage, I have operated on thousands of lungs, and the vast majority of those are smokers, but I've also operated on non-smokers. As a matter of fact, I had the honor and the privilege to operate on my own aunt from Africa who had never smoked. Well, she lived in a smoke filled hut or her kitchen and whatever, and she may have been inhaling all that stuff, junk. But long and short of it is lung cancer is a terrible cancer, but if it's caught early, then there's a greater chance of cure. And oftentimes, a lot of the ones we catch early are the ones where patients, for example, have had a CAT scan for something else, or just an annual CAT scan or chest X-ray, and an abnormal finding is discerned in the lungs, and this leads ultimately to a therapeutic intervention. Now, how can you diagnose lung cancer yourself? Well, if you have shortness of breath, you're coughing, you have chest pain, you're coughing up blood, for example, you get tired easily. When you see the doctor, please ask for a chest X-ray. That's very important. And again, if you smoke, quit smoking. And then about the number 2 cause of cancer death, we're seeing more and more of this. And I've seen countless cases of talked to individuals, and especially from Cameroon at a young age. I've talked to people who've lost loved ones from colon cancer. And colon cancer is a big killer. If you have blood in your stool, you're passing dark stools, and really any change in your bowel habits, when you see a doctor, whether you're having more diarrhea or more constipation, whatever they say, ask them, could this be colon cancer? We need to be aggressive. Why is that? Because the incidence of colon cancer has tripled in the younger generation, younger folks. It used to be we would find colon cancer in individuals 50 and older. Now we're seeing it in people in their 20s. My own assistant, Stephanie, who would work with me for years, and she was only 30 something years old, and she came down with metastatic colon cancer and died last year. So if you're having blood in your stool, dark stools, you're having abdominal cramping, nausea, vomiting, you have diarrhea, constipation, see somebody and be aggressive. And so what's the screening for colon cancer? Well, because we're seeing so much cancer in younger people, the screening recommendations are in flux. I'll tell you what they are, then I'll give you my own opinion. If you're 45 years of age, you need to begin with a colonoscopy. Where you may not have access to it where you live, but if you can get a colonoscopy, that's important. Also, you can get your stool tested for blood, as an occult test. That's what we'll call it. Now, for those who are at higher risk, and what's higher risk? If your father, your mother, a family history of colon cancer, you need to be evaluated sooner, even in your 30s. I would say even in the early 30s. Now, so also if you have a history of polyps, there's something called familial polyposis. Now, I trained as a general surgeon, did a lot of general surgery, operated on a lot of patients with familial polyposis who went on to have cancer. That's a congenital problem or genetic problem where you have a lot of polyps in your colon. If you have any such history, you need to be more aggressive about screening, and that's for colon cancer.
Now, let me just ask you a quick question there. Sir.
Yes.
You talk about people having colonoscopy. How about stool test? Which is better?
So
And
the
why?
best is colonoscopy because it gives you a visual evaluation of your entire colon. And also, if a mass is ascertained or found, or a polyp, the polyp can be removed. And in some people who are lucky, the polyp could be pre-malignant. So you've essentially cured or addressed the situation. Now, the stool test is good uh, for individuals, for example, who are the cancer is shedding certain types of genetic material that can be detected. I don't want to get into the complication of that, but most commonly, if there's any blood in your stool that is not obvious, that's why we refer to it as occult blood. And if it tests positive, and then the next step would be a colonoscopy. That's why if you have access to colonoscopy, that would be the best, the ultimate test actually to evaluate your entire colon.
You are watching Healthline on Chat Night Africa, and we have this erudite, this powerful Professor Nche Abeglizama. He's cut through thousands of hearts around the world. He's seen it all. That's why I thought I should bring him here. If your health is your greatest asset, now you see why you should pay attention. Doc, I'm going to come back to this question again. I'm so eager to hear from you on it.
Yes.
You are a thoracic heart surgeon.
Yes.
What are the screenings that people should be doing to avoid some of those terrible things you have then to handle downstream?
So, heart disease is the number one killer of people in America and around the world.
You
and
see
I would
why
say,
I'm itching to ask you that question?
yes. Number one killer. 1 out of 2 women, 1 out of 2 men in America will die from heart disease. And we don't have the statistics, especially unfortunately in developing countries. And so we can't ascertain. But what we do know is that the prevalence of heart disease is increasing, is rising in developing countries. Now, with heart disease, what I always say is if you have symptoms that make you suspicious that you could have heart problems, you need to evaluate a doctor. And what symptoms am I talking about? It's not just the classic chest pain where you feel this tightness in your chest or you feel like an elephant is sitting on your chest. And sometimes what brings it on is physical activity. You're working around the house, you're cooking in the kitchen, you're chopping wood, you're on the farm tilling. And then whenever you try to exert yourself, you get this terrible pressure or pain. And when you stop within a few minutes, or sometimes up to half an hour, it goes away. Be highly suspicious of heart disease. And I'm talking specifically of coronary artery disease. Or you get shortness of breath with exertion. Now you've not gained a lot of weight and you don't have asthma. All of a sudden, you don't have the energy you used to have. You try to do things and try to be physically active and you get shortness of breath. You get short-winded. If you're experiencing that, suspect heart disease that's developing inside you. Or sometimes you just get fatigue. You just feel tired. You're not doing anything. Well, that's how heart disease can present. And remember, in women, a lot of times in women, those symptoms of chest pain that I talk about, or chest pain that moves to your arms, you feel like the pain is radiating to your arms. Women can just present with fatigue. I'm just tired. I don't have a lot of energy. They think because they're busy, they're working, they're farming, the children, this, that, and the other, and responsibilities. If you have you're experiencing inordinate fatigue that's unusual, you need to see somebody about it. Or another thing with women, gastrointestinal problems. If you're having reflux, like heartburn, people call it gastric. It's really heartburn. If you're having gastric, heartburn, reflux, esophagitis, the doctors have told you have that, ask, could this be my heart? Because I've seen a lot of people have gone on to have massive heart attacks when the primary or the initial symptom was reflux. Or if you have indigestion, certain types of foods that you used to love, now when you eat them, and especially fatty foods or fried foods or oily foods, if you're starting to experience some indigestion when you eat them, well, one of the other things that could be is gallbladder disease. But that's not going to kill you, or not often. But what's going to kill you if it's missed is heart disease, and that's how it can present. Now, in answer to your question, what can you do when you think you may have heart problems? You have some of these symptoms. Please see a doctor. Your initial evaluation would constitute a history, obviously, a physical examination, and some appropriate testing. They'll do some lab work. They'll check for certain enzymes in your blood that oftentimes can signal a heart problem. But more often than not, they'll do an EKG. That is a check, get an electrical a picture of your heart or how your heart is functioning. And if there's certain abnormalities in it that could be associated or make someone suspicious of a cardiac problem, then further testing should be done or will be done. So you have an EKG. Or if the EKG shows some abnormality, or if it's a normal EKG, your doctor may choose to proceed to an echocardiogram. That gives you an anatomical picture, a functional picture of your heart, where we can actually see how well your heart is contracting, look at your heart valves, how well they're functioning, they're moving, if there are any problems with them, and also look at the muscle of your heart, how it is, and look at the regional motions of your heart. The heart is a complex structure, and an echocardiogram can provide a lot of information that can be useful in making a diagnosis and ultimately therapy. Now, if that doesn't show anything and it's normal, but you're having symptoms that are very classic, they may put you through a stress test where they can have you get on the treadmill and you run. You know, they have all these monitors on you, or they have, if you cannot run, they can actually have you sitting or laying down somewhere, and they'll give you a drug that can mimic exercise on a treadmill. And when they do that, they can scan your heart and see if you're having any problems with heart motion, muscle activity in a region of your heart that can make one suspicious for a problem, for example, a blockage in your coronary. And finally, the ultimate test is a cardiac catheterization. When all these other tests have been done and we're not getting any answer, and a cardiac catheterization gives you a precise anatomical delineation of the problem in your heart. And because most heart attacks are caused by blockages in your coronaries, now if that's ascertained, and then they can either open up the blockage in the cardiac catheterization laboratory or send you to a guy like myself for open heart surgery.
Professor Nche Abeglizama on Healthline. Doctor, I said in my introduction that typically people don't act until it becomes obvious that there's danger, there's threat.
Yeah.
Unfortunately, a lot of these dangerous, deadly attacks don't manifest. You don't feel it or you don't see it. Unfortunately, at the time that you are noticing it, it's too late. One of them being high blood pressure. I'd like you to talk. It's killing so many people. It's called the silent killer. Dr. Zama, it is for a reason that you people call it a silent killer. Is it?
Yes, because oftentimes individuals can have severe high blood pressure. We call it malignant hypertension. Hypertension is the medical word for high blood pressure. And they may not know it. They go about their normal daily activities. They go to work, they play, time with family, and everything is good until a catastrophic event, and such as a stroke, for example. And most of us, I see, probably most adults that I know somebody who suffered a stroke. And the major risk factors for that is high blood pressure. And also, I just talked about heart disease, heart attacks. A major risk factor for coronary artery disease, heart disease, is high blood pressure. And also, there's another problem called aneurysm, like in the abdomen. People don't talk about that, but it's a major problem that we see. I've seen it in Asia, operating in South America. It's in Africa. It's in the United States. Abdominal aneurysms. Now, one of the risk factors for getting that, is high blood pressure. So yes, high blood pressure can be a silent killer. And when you have high blood pressure, you run the risk of a stroke, you run the risk of a heart attack, you run the risk of an aneurysm, which can rupture. The aneurysm is an abnormal ballooning of a blood vessel. And if it's not addressed, imagine what's going to happen. If you're blowing into a balloon and the balloon is getting bigger and bigger, what's going to happen? It's going to blow up, and then you'll drown in your own blood and you die. So high blood pressure, it's a major risk factor. Now, what are the things, when we talk about high blood pressure, what are the causes of high blood pressure? Well, most high blood pressure is what we call essential hypertension, which means we don't exactly know what the cause of it is, but we also know that lifestyle, consuming a lot of salt, and the United States, for example, and many other places where I travel, people consume way too much salt. It's like they're having some food with their salt. So if you consume more than a tablespoonful of salt a day, you're probably eating a little bit too much salt. That'll put you at greater risk. If you can drop the salt consumption in a population, you will reduce significantly the number of strokes, the number of heart attacks, and a number of complications for things like aneurysms I talk about, even kidney problems. Why do I say that? Because if you have high blood pressure, you have a greater risk of having kidney disease. Now, there's a lot of people say kidney disease, but there's a whole lot of different types of kidney diseases and causes. It's like saying cars. Now, there's Nissans, there's Mercedes, there's Toyota, there's different types of cars. There's trucks, there's small cars, sports cars. So as far as kidney disease goes, there's a certain type of kidney disease that leads to kidney failure in patients who have uncontrolled or not treated high blood pressure. So that can put you at risk for that as well.
What about
Now,
cholesterol?
well, so another risk factor for strokes and for heart disease is high cholesterol, as you mentioned, consuming too much cholesterol. Now, there's cholesterol is a fat, and there's different types of cholesterols. When you do your tests these days, they have the HDL, the LDL. You see that in your lab results. Now, so what that means is we look at the total cholesterol. That's the total amount of cholesterol in your bloodstream. If it starts to run over 200, it is way too high and it puts you at greater risk for heart disease. So you have to set the highest standards as far as cholesterol goes. And also, for those other fancy terms, the HDL and the LDL, let me just clarify it real quick. Now, let's start with HDL. These are big molecules in your blood that carry cholesterol. Now, the HDL with an H is the good guy because it travels around your body and scoops up any residual cholesterol, excess cholesterol, and takes it down to the liver where it's destroyed, metabolized. So if you have more HDL in your blood test, that's good because you're better protected from heart disease and strokes and other complications that can
What do
arise.
you do to have much of that, sir?
So the things that you can do, excellent question, is lifestyle, for example, lose weight loss, physical activity, exercising. I always recommend give yourself 30 to 45 minutes every day for brisk walking. Any type of endurance exercise will put you in a long way to help build up your HDL level. Also, consuming diets, foods, or use foods that are low in calories and low in refined carbohydrates. I'm talking about consuming more whole grains, vegetables, citrus fruits, things like this, and staying away from animal protein. I'm talking about beef, consuming more fish, and if you have to, more chicken. If you do that, you can reduce your chances, you can increase the level of HDL in your blood. And the types of oils that you use, using more vegetable oils and avoiding the dairy type of oils, butter and stuff and cheese. That will help you raise your HDL. So a lot of this too is lifestyle, as you can see. Now, when it comes to oil, the best oils are the ones that have the high level of polyunsaturated oil. All right. So I'm talking about oils like sunflower oil, for example, canola oil. Yes, that's the cheapest oil. A lot of people say, "Oh, I only use olive oil because that's good." Well, canola is actually better than of all the vegetable oils, and I'm going to include peanut oil. That's from peanuts. You call them groundnuts, and sunflower, safflower, and avocado oil. All these have greater amounts of polyunsaturated fatty acids than olive oil. So the all these, marketing has fooled people. When you go to the supermarket and you always have that olive oil at eye level and you think it's the best oil. Well, I'm not saying it's bad, but you can actually begin to derive greater benefit as far as the contents go from using other types of oils, as I mentioned.
Dr. Nche Abeglizama, I wanted to clarify something. You talked about salt. Now, when I go to do grocery shopping, I pick up. I'm almost obsessed with picking up things and reading the contents and so on. What they call sodium, is it synonymous with salt? Is it the same thing?
That's right. Excellent. I'm glad you asked that. Well, so salt, table salt, the chemical for that the chemical name is sodium chloride, NaCl. So if you go there and say, well, I only use Himalayan salt, I only use sea salt, whatever it is, it's all sodium chloride. And the difference between salt like sea salt and regular table salt that you find in the supermarket is that the sea salt has more impurities. So it's not any better for you. It has a few more things like calcium and manganese and whatever, more impurities in it. Now, if the salt is from the Himalayas, trust me, my brother, it is still sodium chloride. So people get fooled and they pay a lot more money for it. It's regular table salt. Salt, I'm not saying regular table salt is bad. It's just that the amounts of it that you consume, you have to be judicious. Personally, I don't add salt to my food necessarily when I cook it because there's so much sodium already in the natural food that we eat that there's really not a great need for added sodium.
I'm going to ask you this question, and thereafter, I open the phone lines for people to call with questions unfiltered. You're watching Healthline on Chat Night Africa. My name is Divine Nchamukong. Doctor, you talked about blood pressure, the silent killer. We know that. It's just, I'm heartbroken when I hear that somebody has been hit by stroke or killed by stroke. It breaks my heart because something could have been done about it. The question becomes, now, is there a time in one's life that people should go do screening for blood pressure and cholesterol, sir?
Excellent. So, when can you screen? I think any adult, and I'm talking about people 18 and older, for their first physical examination and blood work, it needs to be comprehensive. Why do I say that? Historically, and you don't hear a lot about this, but there was an article and some work that was done during the Vietnam War where a lot of the soldiers, American soldiers, these were young kids. They were 17, 18, 19, 20, 21. Those who died and, for example, and had to, autopsies were performed, it was discovered that a significant number of them had early atherosclerosis, that is hardening of the artery, the problems that ultimately lead to clogging of your coronary arteries and maybe a heart attack. So this is a problem that starts way sooner than we imagine or we think. And you look at the young folks, they look robust, they're physically energetic. But I've operated on 22-year-olds. I've done quadruple bypasses in 25-year-olds who were having symptoms, but nobody thought they could be heart. Now, so what can you do in response? It's a challenging problem, but we know, just be mindful that cardiovascular disease, the two big causes of mortality and morbidity, are strokes and heart attacks. What are the risk factors? Let's talk about the high blood pressure again. You need to know what your high blood pressure is. And if you live in the United States of America or you live in a developing country and you can afford it, please get a blood pressure monitoring device and check your blood pressure at least once a week. Don't get obsessive checking it every day. Pick a certain day like Sunday evening when you're chilling and you're relaxing and you're getting ready to start a new week, a new week. Or you do it in the night or early in the morning, but just pick a day and time that this is the time for me to evaluate my blood pressure. Now, if you have a history of blood pressure, then maybe you should be checking it daily and pick a specific time of the day, usually in the morning, to check it, your blood pressure. If you start having blurred vision or some symptoms like that, oh, that could be telling you that maybe your blood pressure is getting higher, please check it. And if you've checked it 2 or 3 times and you're still getting a high number, you need to see a physician about it. Now, the risk factors for heart disease, for strokes, I've talked about high blood pressure. We talked about high cholesterol. When can you get that checked? Your first lab work in high school or in college, it needs to be comprehensive. Insist that you know, because you got to have a baseline, to know what your normal cholesterol is. So if there's a change, that can be a point of reference. It can be compared to in the future. So all adults should really have their cholesterol checked. And if you're an adult and you get annual physicals, then you should have a comprehensive blood analysis, which includes your cholesterol and many other things, the HDL and the LDL. So get back to 2 risk factors now. So the high blood pressure, the high cholesterol, and we know what to do in checking those. Cigarette smoking and diabetes are also risk factors. So if you smoke, well, there's not a lot of checking there. You just need to stop smoking because you're on a suicide mission. Because if you don't die from cancer, you'll die from cardiovascular disease or any of the many complications that come from cigarette smoking. As far as diabetes goes, well, that's a problem. And you need, once you get your blood sugar checked, and if it's high, and if they cannot ascertain why, I'm talking about fasting blood sugar. And then we need to be sure that you check your hemoglobin A1C. Now, what's the difference between your blood sugar and the hemoglobin A1C? Hemoglobin has to do with your blood cell. Now, if you check your blood and they tell you your glucose is maybe 100, okay? That's a little high, but still not high enough to be diabetic. You can get your hemoglobin A1C and check it, and it would be too high. It would be abnormal. Why is that? Because the hemoglobin A1C gives us a picture of long-term level of glucose in your blood. I'm trying to put it as simple as possible. It tells us how your blood, the blood sugar has been looking for the past 3 months, at least, or more. So if your blood sugar level generally stays higher, that will reflect in your hemoglobin A1C. So it's a more precise measure of your sugar status than your blood sugar. So your general blood work, if it's your first time getting it, or your annual physical, I would insist that you get a hemoglobin A1C and a general blood sugar test. So let me just review that. So history of high blood pressure, history of high cholesterol, cigarette smoking, diabetes. These are the 4 major risk factors for cardiovascular disease. And let me add obesity, because we have this global epidemic of obesity where in some places over 75% of the people are obese or overweight, whatever you choose to. And you know what comes with obesity? A lot of those risk factors. Obesity, you put you at greater risk for high blood pressure, put you at greater risk for high cholesterol and high LDL. That's the other bad cholesterol I didn't talk about. I talked about the good cholesterol, which increases your risk for cardiovascular disease and strokes and aneurysms and all those bad things in your vascular system. And obesity increases your risk for diabetes. We're seeing a lot more type 2 diabetes, and one of the greatest risk factors for that is obesity. So weight management, daily exercise, watching what you eat can go a long way in helping you avoid many of these problems.
You are watching Healthline on Chat Night Africa, and my guest on the platform is cardiothoracic surgeon, one of the leading surgeons in the United States, Professor Che Abeglizama. I'm getting indications from Rosetta Ade that she'll be calling in with a question. Before we take her question, we'll have a musical interlude. Dr. Zama.
Thank you.
Dr. Zama will be right back on the platform. My name is Divine Chamukong. I'm anchoring this broadcast from Washington, D.C. metropolitan area. On this platform are the following programs: Voices of Africa, Healthline, Next Generation Today, Family Matters, and Echoes of Hope. Ladies and gentlemen, here is a 2-minute musical interlude before we bring back Professor Nche Abeglizama to answer some very, very key questions. Stay tuned. I will be right back. All right, Hold My Hand, Never Let Me Down by the Grassfield Music in Bamenda, Cameroon.
Thank you.
Ladies and gentlemen, at this point, we are going to bring up Professor Nche Abeglizama to take more questions. Take note, you can dial the number 240-603-7367. 240-603-7367. If you're overseas, you do 001 and then you dial the number. All right, I'm having lots of comments there. Very knowledgeable physician. Oh, yes. This guy is a walking encyclopedia. He has a passion that can burn an entire forest when he starts to talk about your health. That's because he cares about you. Now, listen, we come here with knowledge, with information that muscles you up. Now, what you do with it is entirely in your hands. We can control that part of it. Ladies and gentlemen, Professor Nche Abeglizama again. And remember, the phone line is now open. You can dial the number 240-603-7367. 240-603-7367. If you're overseas, simply dial 001. That's 001 before you dial the number 240s and so on. Prof, you have cut into thousands of hearts. Do you even remember how many you have?
No. I've just done so many surgeries, and oftentimes when I travel, yes, I do heart surgery, pediatrics and adults. I do lung surgery. But also as a general surgeon, I'm also board certified general surgeon. I get to do a lot of stuff. I do pancreas, liver surgery, kidneys, stomach, colon, this, that, and the other. I enjoy operating, and I don't keep a tally
And you've
on the
saved
number.
lives. You've saved lives while on a flight. You told me that once.
Yeah, it kind of seems to either I've got this, I don't know what it is. Just recently, I was flying from Turkey, and I had a gentleman who there was a medical emergency I had to address. I was on a flight to Beijing a few years ago, and I had a guy who died. I mean, and we started CPR, resuscitated him, started IVs, and good, outcome was good in the sense that he survived, and I heard from the family for a few years after that. But so it does happen. I've been on flights a few times where there's been an emergency or something.
Describe to us the most complicated heart surgery you have handled.
Oh, wow. So I would say It depends. For adults, and pediatric is different. I think for children, uh, something we call transposition of the great vessels, where um, a child was born actually with the heart hanging out of the chest, but the arteries were switched in their location. Um, the aorta was coming out from the right side and the pulmonary artery from the other side. And then now you have to deal with the situation where the heart is not in the chest. And, the baby's born and you can actually see the heart out here. And then the arteries are switched. So that was a pretty tough case. But as far as adults go, I believe it was a guy who had a rupture, the aneurysm I was talking about, right above his heart, not the aneurysm in the aorta in the abdomen, but above the heart. And he was teaching. Actually, this happened in, I can tell you, 2007. He was lecturing, he was a school teacher, and he collapsed. And they rushed him to the hospital expeditiously, and within minutes. And I was getting ready to leave in the evening, and I ran to the emergency room. The call came, and he had no blood pressure. And I suspected, even before the scan was done, I says, we need to take him to surgery. Long story short, he had ruptured. He was drowning in his blood, and the clock was ticking. We had a great team, and opened him up and reconstructed his aorta, kept his chest open for a few days. And the man is still alive. Actually, we're friends on Facebook, and he's doing well. So I had to sleep at the hospital with him for 3 days at bedside, nonstop. That was rough on the body, but
Well,
he
I'll
survived. Yeah.
remember a lot of things you've said on this show. One thing stands out. You say if you are smoking, you are on a suicide mission. If you are smoking, you are
Yeah.
on a suicide mission. Here is a question, Rosetta Ade, I think she's at work. She's a senior medical professional. This is
Yeah.
what she says. Dr. Zama, thank you for this great informative session. Please, and this is her question, please, why do we have so many more Africans dying of cancers, heart diseases, etc.? What do you think is/are the reasons, and what can you suggest Africans, especially Cameroonians, can do to reduce the increased rate of deaths related to these elements?
That's a very apropos question. And put it this way, as I've stated, a lot of the conditions that we confront or we grapple with in our lives um, are rooted in our lifestyles. So, one, nutrition. There's a tendency now to embrace Western nutrition, and Western nutrition is inferior to nutrition in many developing countries, and in particular Cameroon. I can tell you that categorically, for example. So, a diet that is based on whole grains and vegetables and a lot less meat or without meat puts you in a better position as far as cancer goes. The research tells us that. And another thing, this obesity crisis, obesity increases your risk for cancer. And people are not as physically active as they used to be. The thing that protects you from cancer in your blood, God gave this body a lot of potential or things to address issues, to address diseases, to address cancers. The thing that protects you and I is called the immune system. And as I've always said, when you say immune system, most people think of bacteria, viruses, COVID, uh, parasites. Yes, your immune system protects you from these invaders and intruders, but also importantly, your immune system is the system that prevents you from cancer or protects you from getting cancer. As I've been speaking to you, thousands of you out there are developing cancer or have been developing cancer cells, myself included. But what happens is, as soon as that cell changes to become a cancer cell, now I'm putting it very simplistically, your immune system recognizes it immediately. Your surveillance system, it's a real system, and it annihilates it and kills it. But that immune system must be exercised and kept robust. You got to feed it the things that it needs, the micronutrients, the vitamins, the, 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 the whole grains, the vegetables, stuff that it needs. And also, by you being physically active, it keeps the immune system in good shape. When you're physically active, your immune system is also active in better shape to protect you. So if you're consuming things like, um, um, high fat, fatty foods, for example, drinking excessive alcohol, smoking cigarettes, and allowing yourself to be under tremendous stress. Tremendous stress suppresses the immune system. Alcohol intake suppresses the immune system. And all these things conjoined, you can imagine, put you at greater risk for cancer. And let me finish up by adding that if you're embracing the Western diet, for example, those of you who know me, only thing that I drink is H2O, water. Keep it simple. I don't even drink fancy water from a bottle. Well, unless I'm traveling and I'm not sure about, infection concerns and stuff. But at home, I drink water from the tap. Because remember, we have a lot of forever chemicals now in the waters that we drink, and especially if you live in the West, and that's not good. And stay away from these energy drinks, the Coca-Colas, the Pepsis, and all that stuff. And if you embrace that lifestyle, whether you're living in Cameroon, Yaoundé, or Nairobi, you're putting yourself at risk for many things: diabetes, this, that, and the other, high blood pressure, but also cancer. Remember, those in America and in the Western world that unfortunately today, 70% of what we eat is ultra processed. Keep that in mind. 70% of what we eat is processed, ultra processed. Read the labels. And imagine what those chemicals and additives do to your body. They reduce the defenses in your immune system. They irritate your cells in your body. And irritated cells begin to adapt to the irritation by converting themselves. And in the process of converting themselves to protect themselves, they can become cancer. So it is multifactorial. There are a lot of potential causes, but you have to look at the lifestyles of individuals in Cameroon. Let's get back home. And the changes in those lifestyles, how these can contribute. And remember again, stress is a risk factor for cancer.
Wow. When you talk about the immune system, two things come to my mind. Your guardian angels, the military bases that are there in readiness to attack. But then you've got to give them the ammunition. That's by living right.
Yes.
Was that a good summary, Doug?
Absolutely, absolutely. If you want the military to protect you, you got to do right by them, right? You got to feed them well, give them comfortable places, where they stay in their barracks. Keep them physically active, you know what I mean, and in shape, and robust shape, and then they can protect you when the enemies arrive. If you do not do that, your military is not going to be ready, and they'll be annihilated. And that you can use that uh, analogy with your body and how your body functions and your immune system in protecting you. We've always, the old adage that you are what you eat is really true to a large extent.
And your first line of defense is what you put in your mouth. Professor
Yes.
Nche Ableglizama. And Professor Zama will be back in just a minute. You are watching Healthline. My name is Divine Chamukong. The show is on the website, on the internet, www.chatnightafrica.net. It's on YouTube, also in high definition. It's on Facebook. It's everywhere. I want to take this opportunity to thank all those people who have been contributing to support this program. Let me tell you, when we started this platform called Chat Night Africa 5 years ago, we had to go on the phone, on a very rudimentary phone. Thanks to people who are supporting with their wallet, we have a beautiful broadcast. We have an array, we have a plethora of software and hardware. That's why you can get us in this broadcast quality. And if you want to support, well, a lot of you watching, you have my number. You can also go on you go on chatnightafrica@gmail.com. Well, I got something. Somebody sent something from Cameroon to say, thank you, Divine, for the job you've been doing. You are touching lives. This is it. If you want anything looking like this, well, I'm going to give you the number to call. That's Michael in Douala. And he also sent something. He also sent this one. Beautiful things. That's the most beautiful men's clothing store in Douala, Cameroon. If he sent it to me here in Washington, D.C., he can send it to you. And by the way, here's his number 011 237 651 Let me repeat. If you want to reach Michael in Douala, it is 011 237 651 You'll be talking to the owner of the best men's clothing store in Douala. I have a brief, short musical interlude for 1 minute before Professor Zama comes back on. If you come from Nigeria or from Ghana, you certainly recognize this bit.
Africa, just might 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 Africa. Top Night Africa.
Yeah, Chat Night Africa, Africa's voice to the world. Ladies and gentlemen, join me now in welcoming the powerful professor of thoracic heart surgery, Professor Zama. Here we go. So, Professor Zama, I have this question just sent to me by text.
Sure.
What screenings are particularly important for individuals with pre-existing conditions? For example, diabetes, heart disease, or lifestyle factors, smoking, drinking, obesity. People with pre-existing conditions.
So, which pre-existing conditions are we talking about? And
I talked about heart disease, diabetes, and so on.
so, if you have a history of heart disease, what you need to do is you need at least 4 times a year to be evaluated by your doctor. And I'm talking every 3 to 4 months, because things can happen, change, really quick, really rapidly and precipitously. So you need to be followed very close. Now, if you have diabetes, oftentimes, if you're taking insulin or if you're on any one of the many oral agents and you're measuring your blood sugar as you should on a daily basis and making adjustments as far as your medication goes. If you have type 2 diabetes and all you're taking is a pill, and then you really should see a doctor maybe every 3 months or so. Now, if your diabetes is well controlled, whether you're on insulin or an oral agent, because your blood sugars as you measure them are good and everything is going well, then you really need to see the doctor maybe twice a year or so. There's no need for frequent visits. Now, if you do have a history of cancer in the family, for example, or you've had a previous cancer and have had to have surgical intervention, chemotherapy or radiation therapy, whatever. But if you have a history of family history of cancer, and I did mention breast, but there are a lot of other cancers. There's ovarian cancer. There's cancers that run in families, and certain types of lung cancers even. You need to see a doctor at least twice a year or minimum yearly if access is a problem. Now, if you have certain types of cardiovascular disease, now when we talk about heart disease, the heart is just a part of the cardiovascular system. If you have a history of severe high blood pressure, you need to be measuring your blood pressure at home and keep a tally of the daily numbers. And so if the numbers are drifting up or they're staying up higher than normal, you need to alert your doctor, raise an alarm, because you need to have your medication adjusted to bring it down to a normal range. Now, there are certain types of cancers I didn't get to mention, but in many of our young people, we're seeing cancers now. Now, you've heard of cervical cancer. Now, the risk factor for cervical cancer is, a study was done years ago. We found that nuns who'd never had sex don't get cervical cancer, whatever. So we know it's related in some shape or form to a sexual lifestyle. And a lot of younger people are practicing, different types of sexual experiences, but they're more sexually active. And if they are, I would say if you have a child who's a teenager, you need to have a doctor evaluate them and think about getting an HPV vaccine. Why do I say that? The human papilloma virus is by and large an innocent virus, but there's certain types of this virus. Viruses come in different types: type 1, 2, 13, 18. Certain varieties of them have a greater propensity. I don't want to use a big word. They put you at a greater risk of getting cancer if you have certain types of HP viruses. So if you have a teenager starting secondary school, please get them to see a doctor. And you may need to have a vaccine, an HPV vaccine done, because that may protect you from getting cervical cancer, because that's a cancer that you can really cure. And when you get your annual physical, for women, obviously, please be sure that you get a pap smear. And if you're sexually active, young woman, because that can lead to cancer. Now, having said that, one of the cancers that we don't think about is in the head and neck area. And the reason I bring that up when I'm talking about cervical cancer is that years ago, and I'm talking maybe just even 8 years ago, 10 years ago, the most common cause of cancer in the head and neck area was what? Was squamous cell carcinoma, which was related to cigarette smoking. So we saw it in people who smoked and who drank excessively. Two things: alcohol and cigarette smoking account for the vast majority of cancers in the head and neck area. Guess what's happened in just the past few days? Tell you a story first. A very famous American billionaire. I hadn't spoken to him in a long time. Friend of mine and a patient of mine. And he called me. I was listening. I said, I hadn't talked to him in about a year. And I told him, I says, tomorrow, go get a CAT scan of your head and neck. He goes, what's the matter? I says, your voice has changed. He goes, my wife didn't say anything about my voice, my children. Long story short, the next day, he gets a CAT scan. He has a tumor in his head and neck area. Biopsy, cancer. And guess what the pathology showed when they analyzed the cancer? It was HPV, human papilloma virus, which used to cause problems in the cervix in women. Now, the most common cause of cancer in the head and neck area is HPV virus. So kids need to be very careful about their sexual habits. And also, that just tells you when you go to your doctor, be sure that they do a good head and neck examination. When you go to your dentist needs to be looking around in your mouth and feeling your tongue, which a dentist should do for any abnormal masses, because if it's caught early, that's a cancer that 95% of it can be cured.
Well, oh boy, it seems to me there are about 200 types of cancers. But the good news is that you have defense shields in your body. Again,
Absolutely.
that's right. You want to fortify your defenses, your body military bases. You want to give them the ammunition. Then watch what you eat. Doctor has told you how you fortify your immune system. We can't emphasize that enough. Doctor, before we go, I have this question.
Well, let me just emphasize what you're saying. A few years ago, myself and a few colleagues at Harvard and Columbia University came up with some supplements, micronutrients. We have a supplement called Immunomax. A lot of us, the vast majority of us, are deficient in essential micronutrients. When we talk about nutrients, you think about two types. Macro, that means carbohydrate, proteins, and fat. But micro, are the ones that your body needs, include your immune system, at very small amounts. Our nutritional habits and lifestyles either deplete our bodies of micronutrients or we do not consume enough. So we walk around all day with deficient immune system. So we came up with a powerful supplement called Immunomax. And for those of you who are interested, go to www.miamimaxlife.com. You will see it, Immunomax. We're going to have that available in Cameroon in the not so distant future. We have a representative there. I'm also the president of Miami Max Life. All revenue from this company supports orphan education. And those of us who got together to produce this have no financial interest. It's about your health. So think about, and a lot of, unfortunately, 99% of the vitamins people buy in Cameroon and all over the world do not contain what the label states. It's not a regulated industry. I hate to give you to be the harbinger of bad news. That's why we decided to disrupt that and change that. So your immune system, as you stated, it's one of the things that continuously and oftentimes people ignore. We need to make it robust. I take actually this supplement myself on a daily basis, and I believe it's extremely effective in addressing it. Now, you can eat a balanced diet, but we know in this day and age, with our busy
That's right.
lifestyles, that's not an easy proposition to manifest.
Right. Last question for the evening. How does the frequency of screenings change based on age, existing health conditions, or previous screening results?
So I believe if you're generally healthy, you're physically active, and you get a general physical examination and blood work, if everything is normal, then I would not worry about any screenings until you hit 40. Now, let me say 40 because for men at 40, you worry about colon cancer. You worry about prostate cancer. These are like big cancers in men. We didn't get a chance to talk about the prostate. But at 40, you need to get a PSA and you need to get a prostate evaluation with a finger. The doctor can do that. For women, at 40, you need to get your breast mammogram. Well, I'm assuming that at age 30, I tell all my patients, begin to feel your blood, your breast, so you become really comfortable with the anatomy and any changes that may happen. So get a breast mammogram and also get a colonoscopy. Now, the recommendation for colonoscopy is 45. I'd like to see it at 25, believe me, because about, I've said the colon cancer incident in young folks has tripled. We're seeing cancer in people in their 20s. So that's what I would say for the big ones. And then as far as lung cancer is concerned, if you're not a smoker, I don't think you need to be rushing to get a scanning, a CT scan of your chest, a screening CT scan. But if you live with a smoker in the same household or you frequent bars that are smoke filled, that is enough of a risk. That's passive smoking. You need to get a screening CT scan.
Wow. This is a walking dictionary, a walking library. Dr. Zama will be right back for a last word for about 2 minutes. And as I said, well, somebody sent this to thank me for the job we do at Chat Night Africa. If you like it, let me know how you can also get it. And also, this is from the best clothing store in Douala, Cameroon. I got it here. You can get it where you are in the United States or Europe or in Cameroon. And this suit as well. If you like this suit, well, it's from Michael. Thank you so much. And but before we go, here is Dr. Zama. He will give you his concluding remarks. But let me tell you this: pick up a piece of paper and a pen. You will thank me later. Dr. Zama again for his concluding remarks. Yes, sir. Your last word.
Well, we're all a product of our genes and environment. I like to encourage people to be more concerned about the environment, their lifestyles. If you smoke, quit smoking. Watch what you eat. You are what you eat. Avoid ultra-processed foods by all means. Avoid sugary drinks because all these can be harmful to you in the long run. Stay physically active. Try to spend a bit of time outdoors. I didn't mention things like vitamin D earlier, but we're now associating low vitamin D levels with colon cancer. Interesting research. So just taking care of yourself, staying physically active each day, eating appropriately, and I'm talking about whole grains, vegetables and citrus fruits and protein sources from plant-sourced proteins and fish and maybe chicken, and eating in moderation to watch your weight. When you do those things, and being sure that you check your blood pressure on a daily basis if you have a history of high blood pressure, or at least investing in a blood pressure measuring device for your home, reducing the amount of salt in your food, and managing your stress. Don't take on more than you can handle because stress is a major risk factor. When you do all this, you protect your organ systems, your organs in your body, but most importantly, you protect and you invigorate your immune system, which can protect you even if when you do not realize that it's protecting you. When you do that, it will put you on a better path to endless wellness.
I told you so. I told you that when this guy comes here, oh boy, fire. There's wow. You know what? Shakespeare once said in one of his classics that, oh, I have the eyes to wonder, but lack the tongue to praise. Thank you, sir, for this powerful last word that you've shared with the entire audience. Please share this video. Look, Doc, you've got to go to other parts of Africa with those vitamins. You got to go there. People in Malawi will be waiting for you. People in Nigeria, Ghana, Togo, Burkina Faso, South African countries, and so on will be waiting for you, sir.
Well, we have sole distributors already in Nigeria, and I'm getting licensed in South Africa. Yeah,
I'm getting mine. I'm getting mine as soon as I get off this stage, because I have to come and testify how I felt taking it. All right?
Yeah, certainly. We're here for you to support your wellness.
Yes. Thank you, sir. And that has been, well, in secondary school, we said that guy is a brain box. So you see, this is the kind of thing, when you decide to come and watch Chat Night Africa, this is the kind of content you are exposing yourself to, all right? But again, hear me. Knowledge is only powerful when you can act on it now without procrastinating. Did you hear that? Do not procrastinate. In matters of health and wellness, time is of the essence. No time to waste. Merci à tout le monde. My name is Divine Chamokong. That's how we... somebody was asking how they can reach Dr. Zama. Contact me. I know where he is. I'll connect you. I'll hook you up. Look, that's one of the benefits we have here. Now, sometimes I talk like a medical doctor, because when you wash your hands, you can talk, you can sit with your elders and talk like them. Thank you so much, Mauricio. All of you watching, share this video. It's on YouTube forever. It's on our broadcast website. Lots of people, I'm told by my producer, Roger Food, that we have hundreds of people watching on the website right now. Thank you, guys. Be worthy ambassadors of Chat Night Africa, because when we come, we are bringers of good news. This is how we round off the show this week.
Jungle Mix.
Yeah. It's time to say bye-bye on Chat Night Africa. It's time to say bye-bye on Chat Night Africa. You know it's been a pleasure with you, my friend. I can't wait to be there until the end. Bye bye, on Chad Night Africa. It's time we say bye bye, on Chad Night Africa. My young girl, ooh, 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 ooh. We hope you had a great time watching Chad Night Africa. Africa's